Before you start, make sure you have everything you need. You'll need your GlucoRx Nexus meter, your test strips, your lancing device, and a lancet to put in it. It's also a good idea to have a tissue or cotton wool to wipe away any excess blood, along with your monitoring diary so you can record your results straight away. You need to have clean hands in order to perform an accurate blood glucose test. Just normal soap and water will do, rather than any hand sanitizer, as that can contaminate your readings. Start the process by preparing your lancing device. Twist off the lid. Twist the cap off the lancing needle. Insert the lancet into the lancing device and put the lancet lid back on. Your lancing device has a depth setting, so you can change the depth in which the needle goes in order to draw blood. It's a good idea to start off on a low setting and work your way up through the settings until you find one that's good for you. The level of pain does vary from test to test, but without testing you'd miss out on a really important opportunity to get your diabetes well controlled. Every time you test, it's really important you use a new needle. Reusing needles can result in a blunting of the needle, causing more pain. It can also contaminate your finger and lower the accuracy of your test. Moving on with the test, insert a test strip into the meter. Your meter will automatically turn on at this point. Then prime your lancing device by pulling firmly on the end. The button will then turn orange. Hold your lancing device next to the end of your finger. It's important when testing not to use your index finger or your thumb and use the other 3 fingers. When testing, use either side of your finger rather than the centre, as this can reduce the pain levels you feel. You can also test using either side of your finger on either finger for each hand. When you're ready to prick your finger, press the orange button. You can squeeze your finger just lightly, but not too hard. If you aren't getting any blood out, you may need to re-prick your finger. With the first drop, discard it using a tissue or cotton wool and use the second drop. This is so there's no skin debris to alter the accuracy of your result. Make sure your meter is still turned on at this point. Invert your meter and bring your meter to the blood, and the test strip will automatically draw blood up into the meter. It will then give you a countdown. With your result now provided, you can write this down in your monitoring diary, or if you're in a rush, your meter has a memory on it, so you can write this down at a later date. It's important that the used lancet is then discarded into a dedicated sharps box.